Welcome to Integrated Medicine Perspective. I'm Dr. Wendy Liu. With the widespread increase in type 2 diabetes and obesity, weight loss has remained a topic of frequent discussion. And there are many methods out there, from exercise to fasting, from low carbohydrate to ketogenic diets, from detoxing to medications to surgery. The list goes on. So today, let's delve into what makes a good weight loss and what makes a bad one. First off, let's look at a study that observed over 180,000 women over age 50 who were perimenopausal. It found that those who could effectively maintain weight loss, even if it was just a slight decrease, like 2 kilograms over 4 to 5 years, averaging about only 1 pound per year, had a relatively lower risk of breast cancer. The study suggests that weight loss might be one effective means to lower breast cancer risk. Is this observation supported by other studies? The answer is yes. Quite a good amount of support, actually. Exercise and weight loss have a highly positive effect on reducing the risk of breast cancer. Furthermore, for breast cancer patients, a significant weight gain or being overweight during treatment correlates with a higher cancer recurrence rate. So in current preventative medicine practices, weight loss does emerge as one of the key measures to lower breast cancer risk. And beyond breast cancer, exercise and weight loss are also beneficial in reducing other obesity-related cancers, such as colorectal and endometrial cancer. Presently, a wealth research highlights the positive effect of weight loss in cancer prevention. However, there is the other side of the story. A lot of clinical evidence shows that weight loss predicts a higher cancer incidence. For instance, a 28-year-long nurses' health study found that those who lost more than 10% of their weight in a year had a significantly increased cancer incidence the following year. Additionally, a study in the UK found that clinical diagnoses of weight loss were associated with a higher risk of cancer. Moreover, weight loss preceding chemotherapy in cancer patients often signals a higher mortality rate. So why does weight loss prevent cancer in some cases and correlate with a higher cancer incidence and higher mortality rate in others? If a breast cancer patient is also obese, by what we know now, should she lose weight before and during treatment? Now that touches upon the issue of good and bad weight loss. Of course, weight loss that prevents cancer is good, whereas weight loss that doesn't is bad. But where lies the difference between good and bad weight loss? A systematic review helps us distinguish between the two and provides some insight. Out of 34 articles included in the study, nearly half showed an association between weight loss and increased cancer incidence. However, when the weight loss was the result of intentional efforts, it was associated with a lower cancer risk. Intentional weight loss correlates with favorable health outcomes, whereas unintentional weight loss correlates with adverse ones. But why is intentional weight loss good? Intentional weight loss are often backed by improved dietary habits and consistent physical activity. These measures lead to improved metabolism and enhance the heart and lung function. So intentional weight loss occurs with underlying improved function and correlates with positive health outcomes. On the contrary, why is unintentional weight loss bad? We know weight loss is the result of negative energy balance. When this occurs unintentionally, it means the body's feedback mechanisms are impaired, failing to perceive inadequate energy intake or excessive expenditure, or there are digestive disorders hindering energy demand fulfillment. Such weight loss stems from pathological conditions, compromised monitoring function, or digestive ability, or both. Such weight loss is often accompanied by adverse health outcomes. We unknowingly lose weight when we catch a cold, but that is pathological weight loss. Fortunately, once the cold is over, the body restores its normal response mechanism, resolving the negative energy deficit state. So weight loss during a cold is usually temporary and doesn't persist beyond just a few weeks. Intentional weight loss not only helps prevent cancer, but also benefits in preventing diabetes and cardiovascular diseases. However, the case for unintentional weight loss is not as clear cut. There is a phenomenon called the obesity paradox, where overweight and obese individuals have the longest survival among cardiovascular and cancer patients. Now, that seems to contradict the observation that weight loss can prevent cancer and cardiovascular diseases. Could it possibly mean that we should lose weight when we are disease-free and maintain or gain weight when we're sick, even under the condition of obesity? Now, that would be a flawed understanding. Here's why that the obesity paradox is not actually contradictory to the beneficial effects of intentional weight loss. Many cardiovascular diseases and cancers are highly energy consuming and often resulting in negative energy balance. Without a competent monitoring system, which is mostly our neuroendocrine system, and an energy replenishment mechanism, which is our digestive system, achieving energy balance and maintaining weight become very challenging. When the monitoring system is down or the digestive system is not able to handle the increased energy demand, the body cannot respond to the energy deficit properly. Weight loss stemming from functional decompensation is pathological. A well-functioning compensatory mechanism is our must-have defense and is fundamental in combating diseases. However, many weight loss methods are detrimental to our body's normal physiology. To distinguish between good and bad weight loss, we needed to assess whether the mechanisms behind weight loss lead to weakened neuroendocrine and the digestive function. Good weight loss occurs when the body is alert and has good digestive function. Its mechanisms lack pathological elements. Conversely, bad weight loss often stems from weakened defensive function with negative impact on health. Thus, despite both resulting in weight loss, their effects on health are vastly different. So before choosing a weight loss method, we needed to consider whether it creates a pathological condition, whether it weakens our senses or digestive function to achieve weight loss. We needed to ask, if we achieve weight loss through creating pathological conditions, will we actually benefit from it? That's all for today's discussion. Please leave comments and questions. I will see you next time.